1 minute. Your opponent.
Don't
Yeah,
say achieve there.
Yeah.
Life is uncertain and unpredictable, only for those who don't prepare themselves for its uncertainties. As an ophthalmologist, and as a citizen and leader, all of us can face catastrophes. As an ophthalmologist, the major catastrophe that we can face is cluster postoperative endophthalmitis. We have to deal with it as a clinician and as a team leader of the hospital. So, if the patient comes in the late postoperative period, examine the back carefully. Don't pray to God to make this lens matter. Take a bit of step, give intravitreal injections, do everything that is possible. Even if the patient comes just in the first postoperative day, suspect endophthalmitis, fight, take a bit of step, give intravitreal injection. And if it is in the immediate first day post-op, it could be TAS or pseudomonas endophthalmitis, admit, give topical or systemic steroids. If not improving, it has to be gram-negative endophthalmitis. So don't leave it to God, leave it to the retinal surgeon. Any doubt of worsening, take a vitreous tap, give an intravitreal injection and refer to a retinal surgeon to tackle it before the cornea becomes opaque. But this is as a clinician. As a team leader, you have to take your whole team together. See, this is a big catastrophe. And you have to deal with it, and you have to have the team for it together. So make sure that the patients who are affected don't talk to each other. Even not only you, the whole team has to empathize and cry with the patients. For that, you have to act like a leader. Make sure that they understand. See, you telling it is different when the whole team telling the patients and making them feel that you are going to do whatever is possible to help them would definitely help. And make sure that it doesn't reach the press. So crisis management is a production of arrangements through which we diminish defenselessness to risks and adapt to disasters. Crisis management does not deflect or take out dangers, rather it concentrates on making arrangements to diminish impact of disaster. Inability to make an arrangement could prompt human damage, lost income and harm to resources, aka hospital violence. So as a leader, the biggest catastrophe that I had to face was the unprecedented rains, floods, and landslides that wrecked lives in many parts of Kerala. It was a catastrophe that resulted in unimaginable after effects affecting each and every person in Kerala. Though we are from God's own country, we didn't leave it to God. We became actively involved in rescue and relief operations. KSOS was also involved in rehabilitation of flood victims. We contacted ophthalmologists all over India to generate funds for flood relief. I called Professor Dr. Namrata Sharma and Dr. Lalit Verma requesting help. AIOS gave us a generous contribution and sent out mails to help KSOS. KSOS could
Sreeni, your time is up.
Oh. So we could generate a huge lot of money, and we were involved in it. So don't leave it to God. Pray. But don't leave everything to God. She has got lots more to do. Thank you.